So the question is, under the bills being considered, a multitude of new agencies, panels, and commissions are being added to the government bureaucracy. These all need staffing, office space, and operating funds. Please tell me how this will reduce the cost of health care for anyone.
How about if it's not? An acceptable answer? I'll do my Gabrielle Jefferson imitation. That's a very complicated issue. Now let me talk about solar energy. That wasn't pre-planned. When I was at the U of A, I took a class in solar energy engineering. And so, if anybody does want to talk about solar energy, go ahead. I'm going to go off on what Dr. Chernoff was saying. Well, really everybody. Healthcare, it can be looked at, it's just like Mr. Slomak said, it's an economic venture. When I studied economics, and you learn your supply and demand curves, and you can talk about anything, rent control, prices of milk, anything using your supply and demand curves. And that's what governs the prices that we're paying. How many years has LASIK eye surgery been around? 15, 20 years, something like that? My best friend's father's an ophthalmologist, and he was a pioneer in laser eye surgery. Back then, back in the 80s, so I guess that makes it more than 20 now, I guess, right? People were paying several $1,000s per eye to get laser eye surgery. Now you're paying, what, $500 to $1,000, something like that. So that is a market force in action right there, okay? Laser eye surgery, plastic surgery, those types of things are not covered by insurance because that's elective surgery. So that is where the market has done what it's supposed to do. The supply and the demand curves have reached an equilibrium price. Now, I know Byron can understand that, and I know everybody else in here can too, because that's just common sense. So if we get people, us, everybody else, to have skin in the game, that's what I like to say. That's a layman's term for what the economist was trying to say earlier about getting involved and having choices. So if you have an investment in the health care that you are seeking and buying, then you're going to make the most rational choice to do that. People are doing that with the eye surgery and the plastic surgery. So there's no reason why we can't do the same thing with any kind of internal care or anything else. That's just common sense. I have a question for you folks, and I haven't heard anybody talk about this. We have a public health service, and if you go to the Indian reservations, the government contracts with doctors to go out to the reservation and provide medical care. Why can't we do that same thing in the cities where people who don't have health insurance now, so they can get it? I mean, we have Medicaid, Medicare, and those types of things, but there are limitations as to who's going to provide those services because of the fee schedule and all that stuff. But if we were to set up clinics so that the less fortunate people would have access to care, how would that not work?